Hi, I'm Dr. Steve Colacercio of Colacercio Wellness in Caldwell. If you or any friends or family have any pain, numbness, tingling, burning type pain going from the glute down the back of your thigh into your calf, known as sciatic type pain, or you may have some numbness, tingling, burning sensation kind of wrapping around your thigh from the side to the front, chances are your low back pelvic area is misaligned, and because of this misalignment there's a nerve being compressed. So I'm going to show you a crucial stretch that will help realign the low back pelvic area, and most of the time can get rid of this pain that some people have had for 6 months. Can get rid of the pain within 2 days. So basically your lumbar spine is made up of the bottom 5 vertebral joints here, and you can see the way the curve is. What happens is most of the time we don't sit or stand maintaining this perfect posture. We'll tend to slouch in our chair, our desk chair, our couch, or our car like this. So what happens is these joints basically they become stuck or fixated straight, and evidence of this is shown on low back x-rays. A simple lateral view will show this. They call it straightening of the low back or lumbar spine basically. So this stretch will help get the extension back. It'll pull the pelvis forward. It'll take the compression off the nerves. It's usually that simple. So and this type of treatment usually gets glossed over, skipped over. People go right to taking the anti-inflammatories, or even a cortisone or epidural type shot. And it doesn't matter how many anti-inflammatories or cortisone shots you take, it's never going to fix this problem unless you're doing this type of mechanical stretching. So basically, let me demonstrate it. You're going to start off on your stomach. You're going to do about 10 repetitions to start, just to loosen up. So it's going to look like this. 1, 2. Now, it's very important to have a healthcare professional or someone spotting you, holding down the top of your pelvis, because we can all extend at the waist. That's never a problem. It's the vertebral joints in here that get stuck straight, and that's where we need to get the extension in. So I'm going to call in Christina to help spot me. So come on in. So she'll stand behind me and basically just apply a lot of pressure right down on here to stabilize my pelvic area. So just stabilize that down, and this will help isolate extension into my lumbar spine. Now when I come up, I can't get as high, and it's forcing the apex of my extension right around the mid to lower lumbar, low back area. So she's going to hold that down. I'm going to do about 10 reps to start, just to loosen up like that. So now, once you get to 10, you're gonna rest for about 30 seconds, and then you're going to do another 5 to 10 repetitions for a good 10-second hold. And this is what's going to really increase that range of motion, get that extension back into your low back. So she'll continue to apply the pressure down there. And now I'm going to come up. I'm going to exhale. That'll get a little more extension, and you can see the apex of my extension is in my low back. And it's going to be about a 10-second hold. Then I'm going to come down. I'm going to come back up. 1, 2, 3, 4, 5, counting all the way to 10. All right, now, thank you, Christina. So basically, the importance of the spotter is, and I see this with a lot of patients who have this problem, when I tell them to do that, they basically just come right up like that. And you could see the top of the pelvis come off. That tells me that they're only extending at their waist, and they don't really have the extension in here, in their low back. So this stretch should be done every day. And if you have these type of pains, thigh, leg pain, it should be done twice a day. And sometimes this could solve the problem. I've seen people pain for 6 months and pain's gone in 2 days. So thank you very much for listening.